Hello, everyone. This is PHTV4. I'm Sue Jankowski, and you are watching Medical Update. Today, we're talking to Dr. Frances Caprio. Welcome today.
Thank you.
Dr. Caprio, Medical Director of the Primary Stroke Center at Northwestern Medicine Palos Hospital, and Dr. Harish Shownkeen. Welcome today to
Good morning.
Dr. Shanking, Primary Specialty Interventional Neuroradiology. Thank you for taking time to do this interview, and that's a mouthful. You guys got a really long title here. We're here because we're just so happy and congratulating you to Northwestern Medicine Palos Hospital on achieving the Advanced Primary Stroke Center certification from the Joint Commission. But before we talk about that, we're going to get a little background on both of our doctors here today, and just tell us a little bit about your career, your expertise area, and so forth. Dr. Caprio, you want to start?
Sure. So I am the medical director for the Primary Stroke Center at Palos Hospital, and I'm a stroke neurologist, and I am associate professor at Northwestern Medicine, Northwestern University. I trained at Northwestern for all of my neurology residency and fellowship. And I have an inpatient and outpatient practice where I evaluate acute stroke patients that present to the hospital, and I also follow them as they recover in that process.
Wow.
Yeah.
Excellent. That's wonderful. And Dr. Shownkeen, how about you? What's your background?
I've been practicing medicine for 45 years, so I don't think we can do this. But needless to say, I did my training in India and then went to Germany, joined the U.S. Army. I was there for like 10 years, then moved to the United States and did my residency in Cincinnati and a couple of fellowships in interventional neuroradiology, and then started working at Loyola for 10 years, so I have some academic background. And then went to CDH in 2005, and I've been there since 2005. I'm the medical director of stroke for the West Legacy Northwestern, also the director for the interventional neuroradiology program, and just recently been appointed the medical director for interventional stroke at Palos.
Okay, that is a very long journey to get here. We're glad you're here.
You landed up in Palos, that's good.
That's wonderful. It's good for us. Okay, so the certificate is very, very important, and that is the Joint Commission's gold seal of approval. So I guess most of us want to know, what is the Joint Commission?
Yeah, it actually means a lot to receive this certification from such a highly regarded accreditation body. It's been around for a long time. It's a big company, if you will. And stroke, to back up a little bit, is a very complex disease. And so this certification means that we, by the Joint Commission's high standards, have demonstrated our capabilities to take care of stroke patients from the minute they walk into the door. That includes coordination with EMS, our emergency medical services, have our team kind of gather in the emergency room and be able to deliver that acute care. And then when they're admitted into the hospital, there are standards and ensuring that our patients are prescribed the appropriate testing, diagnostics, treatments, and then also to coordinate care for therapy so that they can embark on their journey to recovery after a stroke. So all of that takes tremendous teamwork, and we're very proud of our team here that takes care of our stroke patients and for this certification.
Wow. So to achieve this, really, there's a lot of standards to meet. A lot of people have to be trained in certain areas to get that, and you've done that here then. Yeah, that's tremendous, because stroke is a debilitating issue for people in general, but older people in particular.
Yeah, absolutely.
Yeah, right, exactly. So what does this mean for the hospital now? If someone suffers a stroke or comes here suffering from a stroke or whatever, what would that mean with their healthcare services? How would that change for them?
So Palos has been taking care of stroke patients for a long time, and really with the growth and development of our program, we're bringing in more support and protocols and training to the staff here already. So we have now teams of neurologists, neurosurgeons, in addition to our ER physicians, intensive care doctors, specialized trained neuro nurses, all ready 24/7 to take care of that stroke patient. And we're also technology enabled through telemedicine. So really all of your stroke care is going to be in-house and at your fingertips.
Which is great too, and it's great to have like standards to follow. And I think something that you have is called Get with the Guidelines, Stroke Silver Plus, and it's a Quality Achievement Award. So you got another award, which is wonderful because that's good for the hospital, good for you, and great for the community. But when it's Get with the Guidelines, what are we talking about with that?
Yeah, so stroke in general is a very time-sensitive disorder, so we are always looking to make stroke care faster. But in addition to those time-sensitive metrics, there are a number of other risk factors that we evaluate patients for and treat them for when they're admitted into the hospital. And these include treating them with antithrombotics, which are blood-thinning type medications, blood controlling risk factors like blood pressure, high cholesterol, diabetes, counseling patients on smoking cessation. So the American Heart Association Stroke Silver Plus Award demonstrates that we've met those treatment goals for 12 consecutive months. And when we meet those goals for 24, so 2 years, we will have achieved gold. So that's what we're shooting for next year.
Okay, well, that's great, and it's a great thing to shoot for. And I think that now that we know that stroke victims do best when treated immediately, and I don't think that people realize that or how to identify someone having a stroke. Are there like ways to kind of educate the public, maybe just through their doctor, or are there other ways that we can educate the public, like to identify people having a stroke or something?
Yeah, so the acronym we use is BFAST for recognition of stroke symptoms, and those alphabets stand for B for balance, E for eyes, F is for face, A for arm, S for speech, and T is for time. So you're exactly right. The faster we're able to get that patient to the emergency room, to their acute treatments, the better they do. And now that we have the primary stroke center here at Palos, really it's getting the patient to your local emergency room and having that care readily available to you.
Okay, well, that's, all very important, and it's good to have an acronym like that that we can all kind of identify with. Dr. Shownkeen, so because of these great achievements, what kind of future plans can we look for here at Northwestern Medicine Palos Hospital?
First, I'd like to congratulate Dr. Caprio and her team and the staff at Palos for achieving this certification in such a short time, which is actually a huge thing. Stroke is a large spectrum of disease. It starts from the patient getting symptoms at home, the EMS getting involved, bringing the patient to the emergency room, triaging the patient, whether it gets medical management or interventional management, managing the patient in the intensive care unit, and then rehab. So it takes a village to actually have a very good stroke program. What's fascinating about Palos is getting the best of both academic and community medicine. So you got the experts from downtown Northwestern Hospital coming to Palos, also the local community hospital doctors, and all working together to make this program very successful. So what's the future for stroke? We've done the initial step. We got our certification. So the next step is when patients come with a stroke and they have a large vessel occlusion, where you have a clot in one of the larger vessels in your artery. There's a procedure called mechanical thrombectomy where you actually go in with a catheter into the clot and pull the clot out. So we are planning in starting that interventional program at Palos. It might take us till about the summer of next year to get going because it requires state-of-the-art equipment, a huge biplane, which is very expensive, dedicated rooms, dedicated staff to perform these procedures. And we have just started the process in building that program. So I'm really it's very fortunate that Palos will get this program because the patients then don't have to get transferred to another hospital. The entire spectrum of stroke care will happen at Palos. The other thing we're looking for in the future is a thing called a mobile stroke unit. There's only one in the state of Illinois. It's with Northwestern Medicine, CDH Hospital. We are hoping that in a few years, once the interventional program gets going, we'll have this mobile stroke unit where we take the hospital to the patient and we treat the patient in their house. And this has worked out very well at CDH. So hoping once we meet all the fire chiefs and the EMS personnel, they'll welcome this idea. And these are the two things in the future that we have planned currently. So.
Wow, so this whole mobile unit, if someone has a problem in their home, they call and that mobile unit comes to their home, and that is about as fast as you can get, most likely.
Yeah, because just recently there was actually a fireman in his house who had a stroke, and a bunch of EMS came over to his house, and he looked at these people and said, "What are you doing in my house?" Because he knew most of them. They said, "You're having a stroke. We're taking you into the MSU." And we actually met him halfway between our hospital and where he was getting transferred, which is about 40 miles away. And we treated him in a shopping plaza because we had all the tools to do that. So.
Oh, wow, that had to help him immensely to not have to get all the way to the hospital.
Yes, and he completely recovered in a few days, and he's back home. So.
Oh, my gosh. So this is like such a breakthrough with all these trainings and certifications and awards where you are making it possible for people to then go on and have a productive life again instead of being so debilitated that they're not able to speak or walk or do any of those things. This is a wonderful achievement.
Thank you. That is the goal.
Yeah, very good. Well, I thank you both very much. I'm very excited about all of this going on here at Northwestern Medicine Palos Hospital. There's been some wonderful new innovations here, and we're really pleased in the community that we have this availability here with fabulous doctors like both of you. Thank you for talking to us today.
Thank you.
And thanks for watching us. And go out there and be healthy, be safe, and we'll see you next time on Medical Update.